Hi, my name is James John O'Donnell, and I'm going to be talking about respiratory depression, which is a very important and dangerous side effect from opiates. Opiates are drugs which are used for pain relief, and they are CNS depressants. Examples of opioids include drugs of abuse like heroin, as well as prescription drugs like morphine, hydromorphone, hydrocodone, oxycodone, fentanyl, and many others. It's important to understand the mechanism of action in the brain for opioids in order to understand its effects. So there are three main receptors for opioids in the brain. That includes the mu receptor, the kappa, and the delta receptor. Respiratory depression and sedation are two effects of opioids which are mediated by the mu receptor, while pain relief is mediated by all three receptors. So respiratory depression is the most dangerous side effect caused by opioids. And this is because it can cause a lack of oxygen in the brain. Sedation is also a dangerous side effect because it causes impairment. So if someone goes on an opioid and gets in a car, they'll be impaired and it can get into a crash. A lot of similar scenarios involving opioids. Another situation of impairment would be drug-induced falls, and these are especially important in the elderly, who are most prone for this. So the degree of these different effects can vary considerably, and this is because of differences in potency and also differential preference for these three different receptors. So the respiratory depression effect can be rapidly reversed by Narcan, which is a receptor antagonist for opioids. So basically it binds the opioid receptor and blocks its activation. So it's something which is the first course of action when it's suspected that someone has respiratory depression due to opioids. So in summary, respiratory depression is a very dangerous side effect from opioids, and in cases of drug injury and death from the opioid itself, respiratory depression is most often to blame.